Good afternoon, everyone. I'm Hartford Healthcare's Tina Verona. I am happy to be joined by Karen Weingrod. She's director of the breast program for Hartford Healthcare. We are standing outside of the mobile mammography unit here at Hartford Hospital, Hartford Healthcare. Karen, thank you for joining us.
My pleasure. I'm so happy to be able to introduce you to our coach and to our mobile mammography program.
Absolutely. So Breast Cancer Awareness Month, surely a lot of attention around breast cancer, but of course we like to talk about it really all year round. It's not just for the month of October, but you travel around a lot in this coach. Tell us first off, where are you seen with the coach?
We're primarily in Greater Hartford, but in recent years, now that we have this more sophisticated mode of transportation than we used to many years ago, we can be out and about. We go as far as Mohegan Sun. We go to Waterbury. We will one day go up to Torrington. We go to our East region. We try to make ourselves available in the geographies that the hospitals of Hartford Healthcare service. So we can be many different places. And one of the more fascinating requests we once had was for a Lowe's distribution outlet way, way out in the quiet corner. They didn't have access to radiology, and 30 employees signed a letter asking us if we would come and do mammograms for them. So we go every year to take care of them.
Really, it's a life-saving coach on wheels, and we're actually going to be taking a tour inside. Karen's going to take us inside, and that's nice because, go ahead, Karen, as it is, if you want to lead the way.
One thing I will point out to you, that just behind our stairway, there is a wheelchair lift, so that we're able to accommodate women with any kind of disability who would need that assistance. It comes out right under Our Ladies, right back there.
Okay, that's great. And, we were saying, this really is all about access, and this is bringing the care to the community where women may not be able to get to a hospital or get to a doctor's office, that you're bringing that access to care directly to them.
It's also about convenience because people are so busy. And one of the groups of women I think about are those who are caught between child care responsibilities and elder care responsibilities. They may be working full time. We go to many, many corporations. And with the corporate support for women to take the time, name of our program, to come out and have their mammogram, we're giving them an opportunity that they just might not take if they had to schedule themselves.
So what happens, Karen? Now we're inside the coach, and you come in, and hello,
Hi.
and this is
Roldan.
Dorelli Rosan, and you would be the one registering the patients as they come in, right?
Yes, correct.
Okay. So, Karen, what happens here? They would come in, sit down. I see some paperwork here.
And this computer is directly linked into the Hartford Hospital Patient Access Registration System. So all of the information about the patient is put into their regular clinical record, or one has already been created if they're new to our system. They do some paperwork, some forms, and just like at a radiology office, they'll have a bracelet put on that prints out all of their important information, because we're always going through quality checks to make sure we've got the right patient, even though they're just going down the hall, to make sure that everything lines up.
Safety, of course, the number one priority.
Absolutely.
So we're also standing here in the waiting area, right? With the couch here.
We have the couch. When we've got a full schedule, we can do up to 20 mammograms in a given day. Sometimes when people are really coming on time, we might have somebody waiting, somebody new registering. We try to keep things as quiet as we can so that information is not overheard. But it's a comfortable area. We do have a TV that runs, and people can distract themselves a bit while waiting for their turn.
Sure. Okay. All right. So let's head down the hall here as we make our way toward the mammogram suite. I'll scoop on over here.
So, here at the back of the coach is the mammography suite, and on either side we have dressing rooms. They open directly into the mammography suite, so nobody has to be in a gown except when they're in here very privately with the radiology tech.
I see that you have the door that comes right out into, so that's much
It's very important for us to maintain patient privacy.
Absolutely.
And there is some little amenities in there. You've always got to clean yourself off before a mammogram, but we have also deodorant packets if people want to add something once they finish up.
Sure. And so here's the unit here. This is the mammography unit here. And Karen, tell us how this works. So the patient will come in, have her mammogram. How are the images read? What happens after she has her mammogram?
So the way it works is at the end of the day when we've been out in a community site, we have a hardwired connection to the Hartford Hospital radiology system. So all of the images are downloaded. And then they're read by the radiologist at the hospital. And if everything is fine, looks good, there's a letter sent to the patient. And if the patient has given us a physician they want us to communicate with, the findings also go to their physician. And they're told to come back in a year. One of the things that we do, especially where we've been going regularly, is to schedule our visits for women who are insured 1 year and a day, at least, from when we were last there, so they'll always be covered for their annual mammogram.
And it's important to follow those women, too, to make sure that they are coming back, that this is just not a one-time stop for them.
Right. And then if there's an abnormality seen, the radiology department will contact the patient and ask that they come back in for additional images. And those might be additional views or a targeted area they want to look at, maybe add ultrasound technology just to see what might be happening. And then if there's a need for a biopsy, the patient's physician will be notified. And at times we've had women who don't have a physician. So what the radiologists do is they call the breast program, and we work with the patient to get her into a breast specialty office, a primary care office, our breast clinic, whatever best suits her needs, so that we can get her started on the biopsy.
It really is about access and then the continuum of care that's so important. So it's not just getting women to come in, bringing this service to them, allowing that access, but then continuing that care with specialists.
And that we also have both a lay navigator and a nurse navigator. And in the past couple of years, I would say we've diagnosed about 7 cancers a year on mobile mammography. And it's been extraordinary, actually, because that's a significant number.
Even one is a lot. I like to call this sort of the wonder on wheels, a miracle on wheels, if you will, because women that come here may otherwise go undetected. Is that right?
Exactly. And we had one story where we were up near a fitness center north of Hartford. And a woman saw that we were there, came on and said, you know what, I've never had a mammogram. She was just over 40. Said, come on board. It turned out we diagnosed her with a stage 2 breast cancer. So were we not there, and she's doing great, she would not have known that because she wasn't prompted on her own to get her mammogram, but just our visibility and our accessibility made it work for her.
Let's talk about the health disparities when it comes to breast cancer, because you hear about the Hispanic population, you hear about African American women being at higher risk. Having something like this to go in those areas where you can specifically target where there are clusters of maybe more of that type of population, is that right?
This makes a huge difference in our underserved communities. We have grants and many donations that help us support screening mammograms for uninsured or underserved women. When we go to a local church fair, when we're at our street corner sites, because sometimes we'll just be in downtown Hartford, there's an ease and an ability for women to access their service, and have their mammogram. We also partner with other community organizations like the Malta House of Care. So the Malta House provides primary care services in a van. We will co-locate with them at times so that we can provide mammography to their primary care patients. We do see about at least a quarter of our patient population is uninsured. And we know that people who are not used to accessing health care are nervous about coming to a big institution like Hartford Hospital And so being available in the community is such a benefit.
You know, I will say that just being in here does take away a lot of the angst. You know, you you don't feel like you're in a hospital setting, or you don't feel like you're really in a doctor's office. It's a very warm, very welcoming, comforting environment. And really that's half the battle in women may be afraid to get a mammogram.
Absolutely.
It's that fear of actually going in to a hospital to have it done.
And I think that's absolutely true. And by being at some of the federally qualified health centers, or even at the corporate sites, it's just easy. It makes it easy, and it takes away from some of the, oh my God, now I'm really going for my mammogram experience. And one of the things we're able to do, which I'm very excited about, is it's important for women to be able to be treated close to home if something does happen. And because now we're such a wide system of Hartford healthcare facilities, no matter where we do a screening, we can push those images to another Hartford healthcare site. And so, for example, if we've been in the Norwich area, we can move that image to Bacchus Hospital, one of our Hartford healthcare hospitals, and a patient who lives in Norwich but maybe works where they had their mammogram is able to have care close to home.
So important, and I think it's also important to mention that because it's October and it's Breast Cancer Awareness Month, this is not just out during the month of October, that you are out and about year-round.
We are out and about year-round. We're out 3 to 4 days a week and 2 weekends a month. And it's become a very popular service, and we're thrilled to be able to provide it. There's no other service like this, certainly in the northern tier of the state.
Karen, how would you say, since its inception or maybe in the last year, how many women have come through this coach?
Nearly 20,000. We started back in 2005 with a little portable x-ray machine and x-ray plates, and then in 2012 this vehicle went on the road. And the bookings keep growing, and I'll tell you, I wish we had more of them. Because it really does seem to meet a community need, and we're very pleased to have been able to interact with patient populations that we would never have seen otherwise. And I feel that the supports in the breast program with our nurse navigator, with our lay navigator, really help take patients facing diagnostic procedures or cancer diagnosis all the way through where they need to go.
You know, the nurse navigators are a crucial, essential role in all of this, because going through, if God forbid there is a cancer diagnosis, that's a scary time for a woman, but having sort of somebody by your side and navigating through that process, because it can be difficult, the woman can be under stress, and having that person guiding you along really takes a big weight off.
It's a tremendous support, and you know, there's emotional support, there's helping to get records moved, there's facilitating appointments and more diagnostic testing. There's family support. Our nurse navigator will meet with a family or, you know, a couple just to talk with them and see how they're managing. Our nurse navigator also visits with every patient in the hospital who's having mastectomies. We have an amenities bag at Hartford, and also the same services at our other hospitals in the Hartford healthcare system are provided for our inpatients who are undergoing mastectomy.
And Karen, what do you want to say to women out there who might see the coach coming, the mobile mammography coach coming, and maybe a little bit nervous or hesitant about, I don't know if I should have a mammogram on here? What do you want to say to those women who might be on the fence?
We certainly provide a very high quality service. This equipment is superb equipment, and our follow-up will always take you throughout whatever next steps you need to have. Most importantly, don't be afraid. There's so much that can be done to treat breast cancer, to identify women at increased risks and survey them the way they should be, with follow-up imaging and with specialists who really watch them over the years. To just not be afraid, to know their bodies, to examine their breasts, and to take advantage of early detection through mammography screening. We think, yep, go ahead,
Yeah,
Tina.
I was going to say, and really to kind of sum all of that up, is early detection is so key. It's so vital.
It saves lives. It absolutely saves lives. And I think that the fact that we've been able to continually be diagnosing cancers, we don't want people to have cancer, but we're able to help them and get them treated.
20,000 people. That's an incredible number. Karen Weingrad, thank you so much for all of the important work that you do on this coach, bringing it to communities all over the state. It's tremendous. It truly is. And you're saving lives one by one, so we appreciate it.
Thank you.
Thank you for joining us. And of course, as always, thank you for watching. I'm Hartford Healthcare's Tina Verona. We'll see you soon.